the aim here is we're trying to change ADHD globally, nationally, locally, individually. Like it's that's part. And the section coming up next is incredibly important, and one that's like we've been championing for a long time, which is it's very clear that the crossover of co-conditions, I like to call them, rather than comorbidities, which I think is like such a hard word, and co-conditions, and but in particular autism and ADHD, which this covers, and the title I find an absolute delight. Order and Anarchy working together, ASD and ADHD in some symbiosis. And when I first read it, I was like, well, I feel like I shouldn't like that. I don't think I should be called Anarchy. I don't like, but then in my head, I'm like, I have Anarchy, like the Anarchy all the time. And we did actually, Khurram's about to come on, we actually did go and check it with a number of people who had both ADHD and autism, who had ADHD, who had autism, just to go, like, are you comfortable with this name? Like, because we feel intuitively that we shouldn't be comfortable with it because it's got some negative content, but we all also really, really love it. And it was 100% love. There was no discussion. Everyone was like, man, that's a good title. Yeah, no, that's exactly right. Like, and so, right, without further ado, I'm going to bring them on. Hello guys. Hello, Khurram. Hello, Eleri. You're just fantastic. Thank you so much for doing this. Staying up.
Thank you.
Oh, well, thank you. Like, it's a big deal. It's wonderful having you both, and you both represent it's such important. Khurram, obviously, you're a medical doctor. You have both ADHD and autism, and what we're about to hear is you speaking on the lived experience of them both. Yeah. It's a big deal. And Eleri, you are fantastic, and you've also obviously created an incredible TikTok following and production of videos, and creating a sea change of messaging. TikTok is incredibly important in the neurodiversity world, and I find and you're a huge part of it. And I don't know about you, it drives me nuts when people talking about, oh, it's just TikTok. You're like, by just TikTok, do you mean like billions of people connecting on a human level and understanding and sharing? Is that what you mean?
Yes, exactly.
So I think the format we've got is Khurram, who has an expertise in bringing these talks, who has done how many TED Talks?
It's going to be 5 in October. I'm going to Vegas to do something on those lines, autism and ADHD. So that will be the 5th one.
So we're thrilled to have that experience. And then we're going to be running questions afterwards. So please go to the globaladhd.com, go to the Q&A and put your questions in. Do consider and upvote the ones you like, downvote the ones you don't like. And do consider boosting them where we basically donate and it goes to the top. And then we'll go to those questions. And Eleri is going to be helping with the Q&A part and also answering some questions we've got for her specifically as well. But I think it's over to you, Khurram. Are you ready?
Yeah, absolutely. Thank you very much, Henry, for giving the opportunity, because it's an amazing platform. I've been following ADHD UK for such a long time, and it's such an important resource for those who have got ADHD. So I'm a storyteller. I like to call myself a storyteller. I do not like throwing facts in. I like to throw a story in that makes sense, and then putting information which kind of is intertwined between those stories so that it makes sense to people. Because this conference is about not just professionals, it's about a lot of laymen who are coming in and trying to understand what autism and ADHD is all about. So reversing 2005, and I was doing my core psychiatric rotation in Lincolnshire. I had heard the word autism, and I had a completely different notion of autism than I have now. And my consultant said that, there's going to be a very complex patient. He has been referred for an Asperger's assessment. I'm using the word Asperger's because it's 2005. And you know the significance before pre-2013 era and post-2013 era when it comes to autism and ADHD and all the different diagnoses that have been merged into one. So I was like, okay. And he said, have you heard the word Asperger's? I said, yes, I have heard the word. I said, okay, you're not supposed to do an autism assessment because you're incapable of doing that. You don't have the expertise to do that. I was in Lincolnshire at that time. One of the centers in Northwest, and the North was Sheffield. It used to be the center of excellence for doing autism assessments. And he showed me another report of 25, 30 pages, and I got scared. I said, oh my God, this is such a specialist work. Probably I would never be able to do that. I met this person. I had a completely different notion. I read about it, and he turns out to be an astrophysicist. And I was in his awe throughout the interview and the fascinating stories and his life. And that was my first experience with autism spectrum disorder, or at that time, call it Asperger's. Now, fast forward a few years, and not few years, a year. So in 2006, one of my colleagues, he was doing a research, and he roped me in to do a research on adult ADHD. Now, the year is 2006. You have to remember this, because at that time, adult ADHD was not so popular. They used to believe somehow, some ways, that magically, when you reach 18 years of age, ADHD just disappears. It just vaporizes, and then you become fine. And I was in front of a research ethics committee, and I saw a very familiar figure, a consultant whom I knew from my rotation. I said, oh, thank God, there's a familiar face, probably a psychiatrist. I'll get supported with this at least. So, and as they started, the first comment was, adult ADHD is a sham. I was like, oh my God. And guess who that person was? That was the consultant psychiatrist who I thought would be supporting me. He was the first one who said, adult ADHD do not exist. I'm skeptical about the ADHD in children as well. I think this research should not be allowed to continue, or should not be allowed to begin in our region, because it does not exist. It's a fantasy. People who are pursuing it are living in the fantasy world where they believe anything can happen. It's not going to happen. Adult ADHD is a condition that does not exist. And imagine my frustration and my amazement at such a narrow perception about mental health. So with that notion, I kind of continued with my training. Fast forward a few years, I have passed my membership exam. I was about to go into my higher training when somebody offered me a locum post. And they said, Khurram, will you lead the service? I said, okay, what is the service? And it was an adult ADHD, adult ASD, and personality disorder service in Manchester. And that still date remains the only service of its kind in that region. I was like, yeah, why not? Because people who don't know me, they don't know that I like challenges. So the first thing that came to mind was yes. And I was like, oh my God, what have I done? I've heard about it. I do not have an expertise around it. So I started learning. I started going around learning about it. And that's where I saw a lot of transitional patients coming in from CAMS with ADHD, with ASD. At that time, again, the year was 2010. So it was not 2013. We could only say that certain ASD patient has got inattentive symptoms or ADHD-like symptoms, but we could not diagnose them officially. The history behind it is after DSM-4 was published, they started talking about combining autism and ADHD. The reason they were not doing that before, they thought that the ADHD will take over because the signs and symptoms and the features were very prominent, and the ASD would be completely missed. Part of it was true because A, they did not have the skill set. B, we still do not have the skill set, enough skill set to diagnose his condition, at least not the dual condition. We can do it separately, but not dual condition in a single setting. So those were the kind of conversation. It was around numbers, because even before 2013, they would say that ADHD-like symptoms are present in 30% of the population with autism spectrum disorder. So again, if you look at it, as the title implies, and again, it was a very spontaneous title that came out of nowhere in my mind. I said, how would you describe autism and ADHD? Like there's an order and there is disorganization, but of the extreme nature. Like for me, in my head, because I think quite differently, there are pure ADHDs and pure ASDs, and then there is this overlap. So there are two conditions which are at the end probably a new bipolar or new two-pole illness, you can call it, because they are literally on the opposite poles of each other. But it becomes very different when they coexist. You don't see the same severity either in autism or in ADHD when these conditions are coexisting. And I'll tell you why. So imagine Dr. Jekyll and Mr. Hyde. You must be familiar with it. So the battle they had to fight within a single body, and there was one victor. They could not coexist. The same is the case if you're a Marvel fan, which I am. Bruce Banner, an Incredible Hulk, the battle they had to fight, or talking about two alters in dissociative identity disorder who do not know about each other. So there's a lot of disharmony. But how about a condition that actually coexists? And I'm not talking about childhood, because in childhood, it is extremely difficult. Because initially, when I started, my expertise was in adults. And it was in 2019 when I got an opportunity to start seeing children with autism spectrum disorder. That was 2019. And I was amazed. It opened to me a completely different world, a world full of so many possibilities and so many amazing kids that you could sit with. And I was under awe, like all of them. They had so much to offer, but then when they are not seen or when they are not diagnosed, because our society, our schooling system, our education system, they do not like to touch or manage somebody without a label. They will tell the parents that you get a label and then you'll be able to treat the person or manage the person or deploy some resources to get them in. So most of the time it is about getting those resources in so that they can be helped, those children can be helped. So that was in 2019. And then soon after, I started doing the ADHD assessment. The same organization one day came to me and said, "Oh, Khurram, would you like to do dual assessments?" I said, "Okay, dual assessments. What do you mean by dual assessment?" And they say, in a single setting, when we provide you with all the information, can you assess both autism and ADHD? And that was a daunting task. And imagine what my response was. Of course, yes. It was a challenge. It was an amazing thing to do. And it opened so many possibilities. It helped me understand the dynamics between autism and ADHD. And soon after, I started doing the child autism and ADHD assessment as a dual assessment. And believe me, like it is an exhilarating experience. It can be very stressful initially because you literally have to compartmentalize things. And as you're going along, you're putting things in different boxes and trying to juggle things and to make sense out of so much information that has been provided to you. So being ADHD and ASD myself, again, it's a lot of it is self-disclosure, but people who know this and people who have been around me, they have said this about me ages ago. And I remember when I did my TEDx talk last year about autism, the superhumans that exist amongst ourselves, I got a call from my friend and he said, "Oh, so finally a disclosure." I said, "Yes, finally a disclosure." And I said, "So when did you know that you were on the spectrum?" I said, "Probably 4 or 5 years ago." And he knew me since 2012. I said, "I knew it for about 9 years when you started training with me." I said, "How come?" "Because you were, for every year of the training, you had a task. For example, the year 1 was leadership, and you would get on with roll college, GMC, you would make things happen, and you would master that thing. And then you would move on to something else the next year. And then there was perseverance. And then you could not see other people's perspective. Plus the perspective you're bringing that was so atypical that people could not follow it at times because it was so simplified. And in my mind, I simplified things because as an autistic person, I need to understand things from the very basic, and the basic comes from simplicity. But at the same time, I was lastminute.com, for example. I remember that was in 2008. I saw a patient. I was working in the crisis team in Manchester, and I dictated a letter, and it was a very long letter, 20 minutes letter. And then I realized that there's something wrong. There's something which is not right. Only to realize at the very end that I was holding my hand like this and using it as a dictaphone, whereas actually I believed that I was dictating, but there was no dictaphone in my hand. And my concentration, and I was so distracted that I could not see that happening. There were so many times that I left things, for example, my guitar in my toilet, and the Sky remote in my refrigerator. Like my wife sent me the photograph, and I was at work. I said, "What is this?" I said, "Oh my God, is this me again?" I said, "Yes, this is you." Glasses on my forehead, and I'm running around. Phone, I'm talking to somebody and looking for my phone at the same time. So those are the kind of examples that I had. Plus lastminute.com, doing things last minute. Like when I started preparing this talk, I only prepared it last night, like at 2 o'clock in the morning. And my wife was said, "Aren't you going to sleep? You're supposed to go to work at 6 o'clock because you have to travel 2 hours." I said, "Yeah, I'll manage that." And that was 2 o'clock in the morning. So there's so many amazing things to talk about. But again, I realized that I had ADHD some 3 to 4 years ago. And the questions that when I reflected on it, I came to know that I was actually looking for some answers for the past 45 years. But for me, it became a normality. I thought that the way I was, for example, distracted, not able to concentrate, I was called lazy. I was taken to the hospital so many times because I was distracted. They thought that there's something wrong with my eyesight, and they said that I'm not good at studies. I tried to walk away from it. But the subject that I knew, for example, mathematics and biology, I was so good at it that I would ace those subjects without even preparing for it. At the same time, I was having those problems. So I thought that probably everybody suffers it, and there's something wrong with me. Probably there's some innate problem with me, and I did not understand that. But now talking to my patients, and exactly they tell me the same thing. I remember seeing a patient who was in her 60s, and she hadn't had the assessment, and then she said, "I've been thinking about doing this assessment for about 30 years now, but I did not understand how can I be ADHD when I am so organized in certain parts of my life and so disorganized in other parts of my life." And sometimes I would think that because of those organization, I thought I was ASD, but then the other side was the disorganization, and I had to put it off. And I'm looking for answers. And when I started explaining to her how these things coexist, and she burst into tears. She said, "You have given me the answer that I've been looking for about 30 years. And these are the kind of things that people who have this coexistence of autism and ADHD, because it's not severe. That's the thing. It takes the severity away. If you look at pure ADHD and pure ASDs, they're very obvious, whereas autism and ADHD coexisting in a single body can actually, because they attract each other towards each other, hence ADHD likes to act as a friend. It does not let autism not being a recluse, whereas autism, like a good parent, does not let ADHD being too far astray. And again, this is the kind of theme that I've seen in these patients where autism and ADHD coexist. So reflecting on my experiences, and when I was thinking about it and the kind of life I had spent, I had an epiphany. I said, "Oh my God." Because then I remembered my father. Usually it's the other way around. You see your children, people think, "Oh, I'm very similar to my child, the child who has been diagnosed with autism and ADHD. Probably I have the same traits. Let's get myself tested." I retrospectively thought about my father, who is a mirror image of me, getting too annoyed with simple changes. But at the same time, he used to do things spur of the moment, very impulsive things. And he was such a thorough person, but at the same time, with certain things, he was so irresponsible. When I thought of him, I saw that we were mirror images of each other. But at the same time, he somehow balanced it the way I balanced it for such a long time without knowing about it. So there's always a seesaw. Sometimes it's the autism that wins, and sometimes it's the ADHD wins. But somehow they'd like to keep each other in balance. Now, in this phenomena, when there's a coexistence, what you have to remember is that there's a lot of masking that goes on. So the hyperactive element or hyperactive component of the ADHD, a lot of the time, it masks the underlying autism. A lot of the time, when people come back to me with a coexisting autism and ADHD, once they have been given medication for ADHD, they say, oh, can this medication cause autism? I said, no, this medication cannot cause autism. So what it does is, it kind of manages the ADHD symptoms, hence the underlying autism becomes more obvious. All of a sudden, they become more organized, they become more recluse, they become more annoyed at little changes, which they were not before. So this is an amazing thing about this. There's a lot of masking that goes on. And at the same time, the masking goes the other way around as well. For example, autism spectrum disorder, it masks the inattentive ADHD features. For example, there's a lot of overlap when you talk about these symptoms. And for example, they say that there's a problem with concentration and attention span in autism and ADHD both. But if you look at it, in ADHD, definitely there's an attention span problem, there's focus problem, there are the concentration issues, and they get distracted very easily. But in autism, there's no distraction. The concentration can be so intense. But if they don't want to do something, they will not do it, and they will openly say it. Sometimes those things are mistaken as lack of concentration. And again, this is the nomenclature that we use. For example, if somebody is not interested in something and is not studying, and when somebody is distracted and having lapses of attention and concentration, and this is what I focus on when I'm doing my assessments, that I want to get to the bottom of it, whether the attention span, are they talking about really attention span, concentration, or distractibility, or is it that the person is not really interested? If the person is not interested with autistic features, then he will, no matter what you do, the person will not attempt it, and he will say that I would not want to do it. And similarly, when we're talking about the overlaps, the no filter, they say that there's no filter in autism and there's no filter in ADHD. Now, the filter in ADHD is about, because they say things impulsively, it should not be said, but they sometimes are remorseful about it. They said sometimes they have a reflection and they say, I should not have said this. But when you talk to somebody with autism, for example, they say, oh, if they say somebody who is crippled, say, where's the limb? Why are you black? Why is this color so different? And when you tell them not to say that, I said, but that is true. So that filter, or it's actually a factual statement. And when you challenge them on it, they said, but this is true, isn't it? And you cannot argue with them. So you have to differentiate between these two. No filter because of the factual statements, and no filter because of saying something impulsively and being remorseful afterwards. Now, they say that they have problem in friendships, but in autism, most of the time, they don't want to be with people because they do not know the social constructs. Hence, they do not know how to behave around people. Plus, they're not into small talk because in autism, everything is about purpose. Whereas in ADHD, they lose friends because they get into conflict with those friends. And the conflict is about being impulsive or hyperactive, or they get into fights with those children. So you have to differentiate between the two. You have to understand the nuances which are lying when these conditions are overlapping. Because as such, there's no tool that has been created for either autism or ADHD. We talk about ADOS, ADI, DISCO, then we talk about DIVA, And the Barclay Adult ADHD Rating Scale, or ASRS, or SNAP-4, none of them take into account the other counterpart. For example, ADHD, when it is coexisting with autism spectrum disorder, they don't take into account the factors that could actually minimize or mask some features, and likewise. So I think there is a room for creating this tool. And again, looking at research, a lot of research is done with ADHD and ASD, but most of it is about young children. There isn't much research about coexistence of ADHD and ASD in adults. And even with children, the sample size is so less. Like you're looking at studies with 16 children or 90 children or 70 children, which is not reflective of the society or the bigger cohort that we are looking at. So talking about the overlaps, again, they say pacing. In autism and ADHD, there's pacing. But what they need to differentiate is why this happens. As such, in autism, there's pacing because with circular movements or with to and fro movements, it helps them to clear the mind, and they're able to communicate things better or think things better. Whereas in ADHD, it's not pacing. They're just running around. They're climbing things because they've got so much energy. They're dissipating those energy in sporting activities or in climbing activities. What you should notice is if there's a coexistence of autism with ADHD, a lot of those activities would be solitary activities. For example, running, biking, going into marathons, hiking, where it would not involve another group. Where if you're looking at the ADHD, so-called pacing, I would not call it pacing, but in a lot of literature, nomenclature that has been used is called pacing. It's not pacing. It's actually activities that they're doing because of the increased amount of energy that they have. So you have to differentiate between these two. You cannot be going with a checklist or with other tools going around doing the checklist, because if you do the checklist and if you ask questions very superficially, inquire superficially, then you're meant to lose a lot of substance that lies beneath those questions and probably misinterpret a lot of things and ending up misdiagnosing a lot of people or missing a lot of those diagnoses. Now, the problem that we have at this moment in time, again, is the skill set. And I've always mentioned it, that skill set is because we have not been trained. Like I'm a psychiatrist. I developed this expertise, because I'm a neurodivergent, but at the same time, there was no training provided to me specifically. I acquired my own skills and I learned through experience. And most of the time what we do is, even for neurotypicals who are learning, they try to learn things, not understand things. And there's a difference between the two. Once you start understanding these things become so obvious. Like people who are neurodivergent, neurodevelopmental psychiatrists, when I speak to them in a peer group, again, it is, we have compartmentalized so many different things in so many different ways that even looking at some people, even before the assessments or talking to them for about 5 minutes, we actually know what is happening with them, which is a skill that we have developed by learning, by reflecting, and by understanding. And the understanding bit is missing. As such, there's no training for ADHD, there's no training for autism spectrum disorder. They're sent on courses, different courses, but courses gives you information. It does not help you understand the issues. You need to understand the context, the stories. Those knowledge-based things need to be incorporated with stories or with the proper context for our trainees to understand what is going on. Otherwise, we would not acquire the skill set.
It's incredibly important, the changing of the training that people have to really understand. Now, are you ready for questions? I'm worried we're running out of time. So
okay, yeah, I can go on for 2 or 3 days if you want to. But yes,
well, It would be wonderful if look, next time we'll do a 3-day conference and,
Yep.
and invite you on. A lot of people have been entering questions online, and thank you everyone for doing that. If you go to globaladhd.com to do it, and upvote, downvote your preferred one, so at least the focus is, but Elri's in charge of them, but like she reads the ones at the top first. Elri, I'll hand over to you because you're doing the questions, and actually, I'll hand over to you. And
thank you so much. That was amazing. I really enjoyed that, and it's so fascinating to listen to you and your expertise, and just feel so that I can relate to everything that you were saying. It's just wonderful to hear it and speak about it. So I wanted to ask initially, one of the questions that's got a few upvotes on there already is about autism and ADHD in women. And the question is, does ADHD and autism present differently in women?
Yeah, ADHD and autism both definitely that there's a difference. And again, for example, in ADHD, you see a more inattentive type picture in women, and again there's a lot of overlap. For example, the hormonal changes. If you look recently, I was studying something about premenstrual dysphoric syndrome, and again, it coincides with the extent of ADHD it has in women, and it changes the severities of those symptoms quite intensely. Plus, at the same time, what we have to remember is females, they mask and they mirror better than males. So a girl would see something happening and would try to emulate that in a different setting, although it would not come natural to her, but she would do that. And that's where a lot of the time it is completely missed. And a lot of ADHD is in women present as more of inattentive symptoms rather than hyperactive symptoms. And even if they're hyperactive or impulsive symptoms, they try to dissipate that energy using a lot of sporting activities or a lot of exercising, and that's why those things are not visible. For example, there is a disparity between the ratio of male and female. Again, I say the same thing about autism, because the masking and mirroring, it happens, but again, it's the transitions that actually reveals what is going on. The transition from home to nursery, and from nursery to primary, the primary to secondary, the secondary to sixth form to university, and university to life. These in these transition, things become more obvious, and these are the points. These are the key points where we are able to pick up those inconsistencies or those masking, especially in females.
Thank you.
And Elri, actually, just because that was obviously such a good question, and I can't stop myself asking. So you are the founder of the Women Wired Differently, the ADHD Focus Club. So what's your answer to that question? The same one you just asked.
I agree entirely with what you've just said, and I mean, as a woman that grew up with a family of 5 women, you certainly do learn at a young age how to act in sort of the societal normal standards and present yourself in a certain way. So it certainly makes sense as to why it would go miss if you've sort of spent a very long time masking and learning how to behave. So I resonate with what you said entirely, and I agree wholeheartedly.
Thank you. Well, let's hand back to you asking the questions.
Sure. So the next question would be about stimming, and the question is, how can stimming appear with ADHD and autism as well?
Okay, so again, I've mentioned to you about different kind of motor activities. For example, in autism spectrum disorder, it can be about fiddling the fingers, stretching the fingers. At the same time, it can be flapping hands, which is a very common thing. Plus, at the same time, in excitement, jumping around. That becomes very common. Whereas in ADHD, it's more of hyperactivity, and it's the fidgetiness, it's the restlessness, it's the inability to sit still. Even when sitting down for long hours, they'll be changing postures, they'll make every excuse to get out. Some people, they just smoke in ADHD. They only smoke because it's an opportunity for them to get out and have a breather. Otherwise, if you take that away, probably the smoking will stop. And same is the case for tea and coffee. So this is how they present, and they're quite different if you look at it. But again, people, they say eyes can't see what the mind does not know. Unless you educate them, people, about how they differ and what is the rationale behind it, you won't be able to understand completely.
Sure. Just going off that as well, I wondered if you had a stance on body focus, repetitive behavior as a form of stimming in ADHD or ASD. I noticed within my audience itself, a lot of women had resonated with compulsive skin picking. Of course, you have dermatillomania, trichotillomania as well.
Yeah.
And this in itself is a coping mechanism I picked up as a very young girl, unaware that I was actually, I guess, sort of stimming or self-regulating, self-soothing. And I wondered what your thoughts were for that.
It's trichotillomania, which is kind of taking the hair out when they are stressed, which is a very common feature. Like I've seen so many women that they say that I suffer from trichotillomania. I've got bald patches in my head, and a lot of them, they cover their hair. And it is very common because it's stress induced. Again, it's an impulse control disorder, which is a very common thing. Then picking the skin around the nails, that is a very common thing. Again, if there's a scab, if you have picked, then you just keep on scratching the scab, which happens quite a lot, which cause to a lot of people that can come across as self-harming behavior, but it is not. It's very soothing to them. So yes, these are very common things that happens a lot in ADHD.
Thank you. So the next question here would be, I think you actually covered that entirely. So I'd ask, it's about differences, and ADHD people can accidentally interrupt often. With autistic people, things can seem quite black and white or literal. How does this present itself within social interactions?
Yes, I think it is, again, the rationalization where you have to understand when you ask people with ADHD, and again, I'm very similar. If an idea comes to my mind and I'm, because I'm quite excited about it. Secondly, I know that if I don't do anything about it, I'm going to forget about it. So I have to go and talk to somebody about it instantly, interrupting people. And I've done so in my, for example, when I was in my office, I was doing something, remembered something, got up, and one of the female member of the staff, she got offended. She said, I was talking to somebody, and she was new and she didn't know me, and said, you just stood in between me and that person. I said, I'm so sorry, I did not realize. So I apologize. And when she came to know that this is how I am, she adjusted to it. So this is the reason for interruption in ADHD. Whereas in autism spectrum disorder, they have to, for example, if they hear anything, that there's a conversation going on, and they see a topic of their own choice, then they can talk about that topic for hours on end. They would interrupt people. They would not allow people. They would not understand other people's perspective. And they will talk about it, about the same thing, not about anything, about that particular interest of theirs for hours on end, interrupting other people. Hence, it's different that way. So again, rationalization and getting to the bottom of it, why is it happening, is very important to differentiate that it's happening in ASD or it is happening in ADHD.
Yeah. Thank you. Next one, the title is "You Don't Look Autistic." How do you navigate the comment made by others when you are not the perceived version of autistic and ADHD?
Yeah, like again, it's again, when the two conditions coexisting, it does not come across as autistic. Like people think, at one point they think that I use a lot of extrovert preference, whereas if you see me in conferences, and if I'm not talking about something that I'm interested in, I'm such a quiet person. I'm the lonely person who's sitting in the corner with a bowl of soup and sipping it away and wanting this thing to end as soon as possible. And a lot of people have told me, again, this self-disclosure, when I came to know about myself, for example, when I start collecting things, it's massive. For example, not so long ago, I had this hobby of collecting chess sets, and I collected in the matter of a year, about 35 chess sets. I was on Spock, I was on eBay, I was going around different parts of the country, and I was collecting them, and I created a shelf back home, Pakistan, sent all those chess sets, and it's now displayed in my cabinet. If you look at my Ray-Ban collection, there were 35 or 40 glasses I have. Like, I know each one of those. I hate change. I absolutely detest change. I recently changed jobs, and I am cursing myself. Why did I change the job? Because it is such a difficult thing. But when people tell me to be open about it, I said, the thing is, I'm autistic. It's very important for me to know myself. I don't want to advertise it. I don't want to have a label on top of me that I'm autistic. But if I thought that the label was necessary, I would definitely bring it in. And a lot of people, they disagreed with me. They said, you hide away from the fact that you're autism. And that's why I did the self-disclosure. I'm quite happy. People see me as autism. People don't see me as autistic, but I know my own self and my strengths and my weakness and how I can use them in day-to-day life. That's what's important. And that should be very important to you if you're undiagnosed autistic, or if you are somebody who's been diagnosed with autism. It's your condition. You should know it better. You are the one who has to live with it. You have to interact with others. It's all about you, whether you want to disclose it or not, or keep it a secret.
Thank you.
Thank you.
So the next one.
I think it might be time to wrap up, very sadly.
Is that the time already?
It is the time already. Yeah, we have to wrap up for the next one to start at 1:30.
Yeah.
You guys have been awesome. That was really, really compelling and interesting. Thank you both. Thank you, Khurram, for your talking, your candor and your insight. Thank you, Eleri, for your support, for the inquisitive questioning, for your answering on bringing your own insights as well. So thank you so much. And thank you for being part of this, being part of the ADHD Global Conference. We're very grateful for both of your involvement, and bringing the medical and the TikTok worlds together, I think, is a wonderful and important thing. And thank you both.
Thank you so much, Andrew, for giving us the opportunity and this platform. Like, it's amazing what you have done. Like 24 hours global conference. It is very reminiscent of ADHD. And I love it.
Well, thank you. What are we in? We're 22 or 21 hours in, and 21 hours? That can't be right. No, 11 something.
It's about.
It's quite a lot of live streaming now.
Nine
and a half hours. Thank you. I've got it in both ears. It's it feels longer, if I'm honest. Just amazing and absolutely wonderful. Thank you so much. Look forward to talking to you again, and thank you so much for being part of this. Have a great.
Thank you, Henry, and thank you, everybody. Thank you, Ellery.
Thank you,
Anna.
Thank you.
Thank you.
Bye,
Take care.
guys.
Bye-bye. Bye. Bye.